The definition of nursing is very, very interesting because if you look it up in a dictionary, nursing is to care and to nurture. There is actually no connection with the word nursing and what the job does. You think of lawyers, yes, you think of doctors, strong, professional, educated people, and then you think of nurses as noble and caring, and not understanding there's a significant amount of education needed in order to become a nurse.
People that I meet on the street, just in casual conversation, other colleagues, friends, they would always mention, oh, okay, yeah, you're a nurse. What hospital do you work in? Not all nurses work in hospitals, and the public doesn't really realize that as well, that nurses don't always work in hospital sectors or acute care. There's community, like I mentioned before, research, there's governmental levels that we work in, occupational health, like the list could definitely go on. And when they hear that, like for myself, I work in administration, when they hear that, they're like, oh, you can do that? Like, why wouldn't I be able to do that? They're like, don't you have to have a business degree? And I'm like, not necessarily. But, it's something that they don't know.
On our way to work, to school, to the grocery store, our eyes meet hundreds of other eyes on a day-to-day basis. Sometimes we meet the same people over and over again. We don't know what they do or where they're off to right now. We can only judge by their uniforms or by their appearance. Stereotypes imposed by time and media. We live in a world of humans like ourselves with jobs and professions, the importance of, or existence of, we may not even be aware. What is the role of a nurse? How do we know what nurses do and what nurses are?
What is the role of a nurse in society? Well, she's supposed to be there to take care of the sick people in the hospital.
Well, she's like a doctor's assistant. It's important. I don't know.
I would say administering drugs.
Bringing the food, the pills, whatever.
The roles of nurses in society is to assist the ill and to assist doctors, obviously, and they have a lot of responsibilities from what I understand, but I don't know very much about it.
But I'm guessing the nurse helps out, in the hospitals. To me, it's a step, not under doctor, but they just help out the doctors and make things run smoother. So
no, I couldn't do it. Blood, all that kind of nasty stuff. No, not qualified at all.
Taking care of sick people. No.
It's not something that I would think I'd be good at.
No, because it's really hard. I don't think I can make it.
No, definitely not. I'm not nursing. No.
So who's responsible for the public's passive view? Nurses themselves? The system? The environment they work in? How did the public become so indifferent? Is the media at the root of all this?
In regards to the media representation, there have been a lot of negative aspects towards the nursing profession. Recently, the Dentine Ice commercial that was out in regards to the nurse who entered the patient's bedroom and they closed the curtains, leaving it up to your imagination to interpret it however you want.
There was the Virgin Mobile one, I think, a couple of years back as well. Virgin was trying to sell their cell phones and had the nurse in the very mini skirt with the low cleavage and somewhat buxom, very buxom.
A lot of the sex shops or even the fantasy novels depict nurses as that, but it could be primarily because in some settings, like acute care, ICU, what have you, long-term care, a lot of the time nurses have to be kind of intimate in that sense with the patient where they have to perform procedures on them where they might be exposed. The patient will be exposed, and it's a little bit uncomfortable for patients where you're doing things with them, and it's probably from that way.
However, women used to dress like that about 50 years ago, 40 years ago. There were some nurses out there who went into the profession just to marry a doctor. Were they a little bit more provocative? Possibly. I mean, I went to school with a number of girls who just decided to go into nursing to find themselves a doctor.
You know, when I was going through nursing school in my undergrad, I've often said that, you know, when you open the nursing texts, what you see, I'm not sure today, but certainly when I was going through nursing school, the nurse was always a female, the patient was always a male. And to me, that was a big problem because I didn't have a role model to relate to, even from a picture perspective. You know, I've constantly seen nurses as females. And then when you get into your practice setting, certainly there's a lot of stereotypes. You know, I mean, the most common ones, you have to be homosexual to be a nurse, and whether it's true or not is irrelevant, but that's the very common one. The other one, of course, is you cannot be as compassionate or empathic as a female because you're a guy. And you're not supposed to, because you're supposed to be strong, you know, you can't be sensitive. So certainly these kind of stereotypes are still, I think, still persist. Not often, but many times I've encountered, patients not wanting a male nurse, whether it be a female, even men, because of these stereotypes. Well, you must be homosexual. I don't want you as a guy to see me naked. So yeah, it takes time. You know, people don't know what they don't know unless you experience it and then realize the difference. I mean, there's very few individuals that just flat out couldn't have a man, religious issues or cultural, so we had to respect it.
For most cases it wouldn't matter, but if it was something more, of a male injury, then yeah, you would prefer a male nurse, I would imagine.
Female, yeah. Definitely female. I can't tell why, but...
A female. Because I'm a male, that's why.
I don't think it matters. I think they do both jobs, they have the same education.
For a female, maybe for me because I'm a female, so maybe easier to understand each other. So yeah, something different pain or worry between men and women. So
they're all professionals and they each have a role. I think it's great if there are more males in the profession.
Well, like a female nurse is nice, the stereotypical like porno star or whatever, but in reality I don't care. Like if I'm bleeding or something, just fix me, like who cares?
It doesn't matter. It doesn't matter. As long as they're qualified and they're good and they've got good bedside manner, it doesn't matter.
Female, I say.
Why?
Much comfortable, much organized.
I think it's all the same. To me, it doesn't matter. As long as I'm getting not sick faster, that's great.
It doesn't matter if it's a male or a female. It's just how well you do your job kind of thing, and if you do it out of your heart, because jobs like that you have to do kind of, from within, not just, I'm a nurse,
I've actually never had a male nurse, so I couldn't say that.
As of the year 2007, 6% of nurses in Canada are male. Quebec has the highest proportion of male nurses, 10%, while Ontario takes second place at 5%, and these numbers are very close to world averages.
I think men in nursing provide a different aspect and a different color and a different diversity and a different approach to care, and I think it's absolutely important. I think we're going to, we should miss that boat. And I think that'll be beneficial to a patient to see more than just one type of person or individual or category of people providing care.
Medicine and nursing are not the same. We work within the same area, within the same milieu. We have the same form of education as far as science background is concerned, as far as anatomy. That is very similar, and that's where a lot of the interprofessional education is coming from that similar basis.
It's always been the case if I go into a patient's room, hello doctor. It's never, I had to correct it, no, I'm your nurse. Mm-hmm. Oh, why don't you want to go to a medical school? I'm pretty happy with what I'm doing, and opens your mind to a lot of things you never thought before. I think what doesn't help the image of nurses is nurses who don't take themselves seriously, who don't take what they do very seriously. And I think a lot of us may not be doing that. So often enough you'll hear a nurse say, I'm just a nurse. Well, don't say that. You're a nurse. And I've corrected people many times on that. And that, that trickles. That stays in your head.
The image of nursing is unique to the individual. We come together as professional. We definitely need the empirical knowledge. We need a solid knowledge base from where we have a very, very solid foundation. And from this foundation, we build a framework. And wherever you're going within the framework, It's this unique human connection that makes that contact with that one patient at one time a unique image.
You can never accurately stereotype anyone, but as humans, we tend to like to create categories: lawyer, electrician, musician, teacher, nurse, and then fit people into them. So, do you want to fit the stereotype of a nurse, or help change that stereotype? It's up to you.